Good morning. My name is Anthony Mulenga. I'm a staff analyst with the Houston Health Department, and as part of my duties, I'm also a member of the Centers for Disease Control National Wastewater Surveillance System, Wastewater Center of Excellence in Houston, Texas. Today, we are going to be talking about the role of public works in the wastewater-based epidemiology program. With me today is the Director of Houston Public Works, Carol Haddock. Director Haddock has been the Director of Houston Public Works since 2017, and she oversees a system that includes 39 wastewater treatment plants. The Houston wastewater system serves over 2 million people daily, and today I'll be asking her questions about Public Works' role, the importance of partnerships for the program to succeed, and more. Director Haddock, good morning. Thank you for being here for this interview.
Oh, good morning, Anthony. It's my pleasure to be here today.
Okay, so let's just jump right in. And so the first question I have for you is, can you describe Houston Public Works' role in the Houston wastewater epidemiology system?
Absolutely. So first off, I want to say thank you for allowing me to talk about what we do as we get through this. And Houston Public Works includes the combined utility system, so both our water and wastewater system. And one of the things that the Houston Health Department and Houston Public Works have in common is that we prioritize and we focus every day on the health of our citizens. Water system is one of the best things that you can do for community health. And a wastewater system taking and treating that waste is also huge for public health. And so we're partners in the public health of our community. And so this involvement with the wastewater epidemiology system really was a way to capitalize on that joint mission that we both have of safeguarding public health and recognizing that we collect this wastewater and we treat this wastewater, but it has so much information that can be used for public health. So our role was basically to collect those samples, those wastewater samples, from our wastewater treatment plants and make sure that they were available for y'all to sample, not to sample, but to actually test in the laboratory. We also spend a lot of time training your employees how to take samples at specific locations. So sometimes we wanted samples at schools, sometimes we wanted them at shelters, we wanted them at some of our incarceration facilities to make sure that we understood what was happening, so that the health departments of the community understood what was happening with regards to COVID and the increases and the decreases and things like that. So it really was for us, it was 2 days a week originally, and now it's down to 1 day a week. But we're still sharing those samples, and we're still working with y'all on making sure that what shows up in the wastewater is available. And not only do just the samples and what's in it, we also provided the flows. We provided the information on what we were permitted, and then the amount of flows that we got on those particular days, because that also helped with knowing the data and knowing what was going on with it.
Yes, it has been great having a partner like Public Works. And so can you talk a little more about how the collaboration began and how this partnership has been maintained between Public Works and the Health Department?
Sure. So this actually dates back to April of 2020. So it was fairly early in the pandemic that we were brought in. There were already conversations going on in the health community on how we could track, how we could monitor, how we could know where these areas where we were seeing a lot of transmission. And so we were brought into those discussions, and the question was, can we even physically get to places that we can sample? And some of those discussions, not only can we get to the samples, can we safely get to the samples? What is the safety protocols for our employees? What are the protocols for your employees? The health department was providing immunizations and having direct contact with people that had COVID, and so there was a lot of concern about worker safety, for both departments as we took to that. Public Works has laboratories for our wastewater, but our laboratories only are for the things that we're regulated for. So it's for the E. coli, it's for the total suspended solids, for the oxygen demand, things of that nature, not for the types of medical viruses and antigens and all those things that the health department was. So it was really important to us to take good samples, but samples that could be continue to serve our regulatory purposes, but could be used for the medical purposes. So we split those samples and made sure that you got good, clean samples, that they were taken the right way, and that they could actually go to the different labs to be treated the way to be sampled and to be evaluated the way they needed to be evaluated.
Right, and I think that has been a huge positive for us, having a public works system that is set up that way. But in terms of like having the wastewater provided to us, do you think there is a code of conduct that has to be maintained for any analysis results or anything like that, how the sharing should happen between the health department and public works?
So absolutely. So there should be, and this is important for anybody that would embark on an adventure like this in the future. The roles and the rules and the processes need to be clearly defined and agreed to up front. We need to understand whose employees are doing what. We need to understand who owns what data. Our regulatory data needed to stay with us the whole time for our regulatory purposes. But the health data, we collected the samples, but that data was always under the purview of the health department. It was never under the purview of Public Works. And so how we interact with each other is even part of that conduct. The chain of custody of the samples, making sure that all of us understood, and so there was no misunderstanding and there was no lost effort or wasted effort for not having those relationships and rules established up front.
Of course, yes. And then tacking on to that, is Public Works receiving any funding for their roles it plays currently? And if not, do you think the funding should be required for Public Works? And do you have any ideas of where this type of funding might come from?
So I will tell you that we did not receive direct funding for most of the effort, and there has been discussion of using some of the pandemic funding to reimburse the overtime that we perform to collect these samples. I would say that if this is something that's going to happen long term, there probably does need to be a funding stream. If you're going to see this spread to other utilities throughout the United States, there's going to need to be some mechanism both for the staff time and also for the samples, the resources, the tools that are necessary to actually pull the samples and transmit the samples. Does that come through the CDC? That would be a logical place for it to come through. But it's certainly something that needs to be considered, even if you're looking at it from the water and sewer rates. That's something that we would need to build into future rate studies if it was something that needed to come out of the utility. And I'll go back to how I started. The reason that we have the water and wastewater system is for public health. Right. And so having a public health purpose is not at all out of line with what our mission is.
And you did talk just now a little bit about having new utilities come on. Do you have ideas about how we can encourage new utilities to come on to wastewater-based epidemiology systems?
So I actually don't think it's going to take a lot to convince most wastewater systems. The people that work in the water and wastewater system are passionate about serving the community, and they're passionate about that health piece of public health. And so I think that within the confines of resource limitations, staff limitations, time limitations, I think everyone in the wastewater industry would be very interested about how can we use the existing infrastructure to be able to access better data to help inform community response to overall health. And I think that's something that most would be very interested in. It's going to be a matter of, do we have the resources?
Right.
Do they have the resources to participate?
Okay. And what do you think, going a little bit back to our internal system, the future between Public Works and the Health Department would look like?
I think that this particular pandemic, and I will also say that this particular mayor has taken down walls between various departments. Historically, we've all safeguarded our funding sources, and it's been hard to work through those different funding sources to benefit each other. And what I see today, and I believe this will continue moving forward, is that we're going to look for opportunities where we can leverage each other's strengths, our technical expertise. I can see us calling on the health department to support us. I can also see the health department calling on us. And some really good examples of that, we already use the health department to help us track down where we have illicit discharges, where we have things that are coming into the storm drainage system, to be able to trace that back and find out where it's coming from. We already partner with the health department in fund positions to track down fats, oils, and grease in our wastewater system, and grease traps associated with restaurants. So the partnership is strong, and I think that this is the type of thing that makes it even stronger, because it's actual staff working daily with each other, as opposed to us both working towards the same goal but separately.
Okay. And so, building on this partnership that's been fostered here in Houston, do you have any advice for other utilities or new utilities that are starting a relationship with Public Works?
The health department. With the health department, no, absolutely. And I will say, in most cities, the utility is not necessarily in Public Works. It may be a standalone utility. It may actually be that the water and wastewater system are completely separate from each other. There's a water system and there's a wastewater system, utility that don't work together, or that are not in the same governance. What I would say for those utilities out there, for those health departments out there, that start with the conversations about your mutual goals, and that safeguarding the public health, that providing the information to access to information, access to data, sharing data where it's appropriate, is something that doesn't really cost any of us anything. It really is something that is, in the best interest of the public to do those things. And so if you're looking at those in other cities, I would encourage those conversations to start and see where it provides that benefit.
Okay. In addition to just having a clear channel of communication, do you have any other challenges that you think utilities should be aware of during the partnership?
Houston was very fortunate because in addition to having 39 wastewater treatment plants, which most cities have one or two, so we had the ability to narrow down into specific neighborhoods. We also have a significant number of lift stations, and many cities won't have that. So I can see a lot of places that the challenges will be, where do you get those samples? How do you narrow it down to almost the neighborhood level? Because that's your intervention goals in the health department were to try to get to the neighborhoods where you were seeing the highest transmission. And so you have to have the ability to get the samples to create that data so that you know where that is. So I think that for many cities that's going to be one of the challenges, is how do you technically get samples in meaningful places? And then not only do you have the meaningful places, physically, how do you get to those samples? We don't build our wastewater systems to be easily accessible.
Right.
I mean, that's just not part of how they're built. And so making sure that you're thinking through those things. And we've even talked internally about, do we need to design a sampling port that could be added to hospitals outside the building, but before it comes into the public system? Do we need to work with industry to see that there's some things that we just didn't think about 15, 20 years ago, or heck, even 3 years ago?
And so, despite the challenges, what benefits do you see utilities gaining from being part of a wastewater-based epidemiology system?
Oh, so, this is where I'm going to be selfish. So for wastewater systems, if we can be part of this health side through CDC and through other federal agencies that are normally not involved with utilities or involved with public works, it opens up opportunities to access technical expertise and to access funding. And those are huge avenues for a utility that's looking for ways to continue to improve.
Okay. And speaking of access to additional funding, there are some funding sources that might have additional regulations, such as the EPA's regulations regarding testing at wastewater treatment plants during wastewater-based epidemiology activities. What do you think about any of those regulations that might be added to how a utility operates?
Oh, so regulation is one of those things that makes people nervous. We need it. We need to have clear goalposts for what it looks like to do your job well. And when we look at those things, I mean, on a daily basis, we're challenged with the weather conditions. We're challenged with mechanical issues. We're challenged with sometimes just reliable staffing. I mean, during COVID, we were impacted the same way other utilities were, other industries and things of that nature. So when it comes to regulatory, I know that there needs to be very firm rules, but I also know that from a regulatory point of view that some of these areas that we're wandering into need to start probably as voluntary as we all figure out what looks best, what provides the best data, before anything would be turned into something that is a requirement.
Right.
And we see that across the board in a lot of things, but it definitely should be to start with voluntary. I think that's part of why this was so successful, is because we all voluntarily got together and worked together for the right outcomes.
Okay. And so that kind of like voluntary participation may not be ubiquitous throughout the nation's utility health department partnerships, but what kind of, advice can you give about keeping the motivation going for all of these efforts for wastewater-based epidemiology?
So, and this is an answer that's kind of across the board. There is a gap in how we appreciate the people both in public works, in our utility system, and in our health departments that are doing this hard work on a daily basis. There needs to be some public recognition of the hard work that's being done to make sure that that our employees are seen, that our employees are appreciated, that they're respected, that they know that what they're doing has value and meaning to the overall community. And so when you talk about that motivation, most of our employees, we want to be paid fairly, and we want to be, we want money not to be an issue. But beyond that, most people that work in public service, their passion is for that public service, for that public health, for the public safety, for all of the things that they show up for. And so how do we make sure that any program we create directly recognizes those contributions and provides opportunities for them to fill in like you're filling in today, and to be recognized for the hard work that you're doing on a daily basis, and to also appreciate. We have, first responders are recognized all over the place, but how often do we recognize our health department employees? How often do we recognize our utility employees or our public works employees for the hard work that they're doing on a daily basis? That's a big part of keeping our staff motivated.
Okay. Thank you for those comments. And I guess looking more into the future, what are your thoughts on wastewater-based epidemiology expanding to more targets? Obviously, this effort began because of COVID-19, but as we move on to look at things like antibiotic-resistant genes, what do you think will impact that will have? And what do you think the code of conduct, as we discussed earlier, would look like during this expansion process?
Houston is a wonderful place to be having this conversation because Houston is so diverse. Houston is, and a lot of people don't recognize it as an international city, but we have so many people that moved here, but we also have so many people that come and visit here from other parts of the U.S., from other parts of the world. So when we think about expanding this to other things, the response I got from my team was, well, we're already doing it for monkeypox. We're already partnered with the health department in doing that type of thing, and so this just makes sense to keep doing that. The question becomes, how do you do it in a way that it protects individual privacy, but still protects total community public health. And when we're looking at that, that's one of the things that comes into that code of conduct. You know, we don't want to collect data that's only 10 houses, because that gets pretty tight. But if you collect data that is, you know, thousands of houses, you can get a good indication of what's going on, but not narrow it down to that individual thing. So what does that code of conduct look like? As we look at other things, we're going to have to be very mindful of how we collect data to still protect that privacy. How do we continue to expand it to more targets? I think that we have to be flexible and recognize that we can't just chase everything, but that we need to work with and depend on our health experts to say this is one that's important enough for us to do this, and maybe this other one is a concern, but it's not the same priority.
Okay. And earlier you did mention a little about the system not intentionally being designed to support things like wastewater-based epidemiology. Do you think that in the future that is something that could be built into building codes to support things like that?
I do, and I think there's a couple different places that we could look at that. We could look at how we design our infrastructure to have these sampling ports that could be accessible. I know that we had our employees. In some cases, we would turn off a lift station and go in and pull a sample, literally climb down a ladder, go in and pull out a sample. And if there had been sampling ports or ways to get those samples, it would have been, it would have been less impact to the system. It would have been less impact to the employees that are having to do this. But if you look at the building code side of it, if every hospital was required to have a sampling port as part of the original construction, or then that would just be taken care of. It would be there.
Right. And then, so these types of like future wastewater infrastructure technologies, do you have any more examples of what could be potentially added in addition to just building level ports and things like that? Perhaps things on the street level, maybe?
You know, that's a good question, because one of the other things is there were some samples that were taken out of manholes in the middle of the street, and you know, so how do you make sure that we have those in places where it's at the street level, but it doesn't require people to shut down traffic or to be in a road to get those samples that are necessary. I don't have all the answers to that. And that's actually part of why I'm excited about this partnership, is because we can learn from each other. We can challenge each other and ask those questions of what would be the best place to go get a sample, and then we can challenge our industry to what would be the best infrastructure to be right there so that the sampler can easily access the sample. Now, we'll add to that and say, maybe these sampling ports eventually would have enough technology in them that they can give you flow data, they can give you temperature data, they can, you know, that they can record more than just pulling a sample.
Okay. And then there are privacy concerns around wastewater-based epidemiology, especially as we expand the list of targets from SARS-CoV-2. So what do you think Public Works' role specifically will be in addressing some of these privacy concerns?
So we talked a little bit about that, about you know, not making the sampling areas so small that you can narrow down. One of the things that is probably good about this is there's a little bit of separation. So Public Works, while we may have been pulling samples and providing them, we were not on the analyzing or on the data side of that. And so part of that code of conduct and part of that agreement and processes up front is to make sure that the data is safeguarded, that it is only handled by the health professionals that can actually have access to that data, that can interpret it correctly. If you were to ask me about, you know, what some of the results meant, I'm not any more knowledgeable than the general public on some of these lab results. We can talk all day long about wastewater and wastewater treatment and all those things, but I am not a health professional when it comes to pandemics and infectious diseases and things of that nature. And so that's a big part of it, is making sure that we're all working in our area of expertise, and that we do definitely that the data is safeguarded from the point that it's collected, from the sample collection to the laboratory to the data that's being used. And I think it was very important that the health department, Rice and Baylor College of Medicine, were the ones that were working with the data. And at that point, Public Works wasn't, because that's not our expertise, and that's not where we should be involved in that discussion.
All right. Well, thank you for your time, Dr. Haddock. That's it for the questions. And thank you all for watching, and we'll talk to you again soon.